Hello, my name is Luann Lonergan and I will be your registered nurse today. Can you tell me your name? Mrs. Smith, wonderful. And can I see your armband? Beautiful. Alrighty, I'm going to just get the bed up a little bit here, and it looks like it's been about a week since they've changed the colostomy appliance, and so we're going to do that whole faceplate change. We're going to do the whole thing. Have you been having any discomfort at that area? Good. There should be no discomfort at all, and there really shouldn't be any discomfort as we're changing that appliance. Sometimes if there's a little burning sensation, I'm thinking that there could be some skin irritation underneath that faceplate, but you haven't had that, so I'm feeling real good. Alrighty, so I'm just gonna lift up here and take a look at this system, and I'm looking at the time, and this is a beautiful time for us to be changing this. I'm just gonna get a few things here. I'm gonna move my garbage. This is a nice time for us to be changing it because it's after, it's before lunch, and I believe your visitors are coming at about noon today, so they'll have lunch with you, so this will be a nice time for you to be doing that. Alrighty, so I'm going to just grab out a Chuck's here, and I'm going to have a bedpan available. Good job. So I'm going to just get this set up here. And Mrs. Smith, I know that you've had this for a couple of months, so I'm just going to review some things here. And if you have any questions, let me know. So how about if I do the change today, and then tomorrow you'll be able to do what you feel comfortable with. The first thing that I would like to do is I'm going to empty out the pouch. So I'm going to get a couple of tissues and have them readily available. I'm going to put my bedpan, and I've got a clamp here, so I'm going to undo the clamp. And the clamp is reusable, so I'm going to just set that off to the side. And what I really like to do is fold back the tail of this pouch so it doesn't get that feces on it. Beautiful. And now I'm going to empty that out into this bedpan. Beautiful. And since I'm looking, it's on the left side of your abdomen, this is, generally a little bit mushy, somewhat formed here on the left side, and that's real anticipated. So I'm going to set that down. And really, I like to wipe this off here so that it's clean when I put that clamp back on. Beautiful. And I like to you have a clamp system. Sometimes there's a Velcro, but I don't have this here, so I just fold it one time and then I shut it, and that should be good. Then it's on nice and snug. What I can do with this bedpan, many times I take this right away to the bathroom and just put it in there, and I'll deal with that later. For right now, I'm going to just set it right here on the bed. And if that was, since there's not a lot of effluent in there, we're okay. But I certainly could take that to the bathroom. Now what I'm going to do, since this system is about a week old, I'm going to take off the whole thing. So really I'm going to pull back here and just kind of noting what I see, and things look good. And these bags can be saved and washed, so I'm going to put that here, and again we'll be able to take that and deal with that later. And it's coming up a little bit here, so I'm going to just hold taut the skin so I don't pull on it. So I start at the top, and I'm just going to work my way down. How are you feeling? Okay? Beautiful. So I'm just lifting up here. Good, everything looks good. And I'm going to do some cleansing of that area. So this can really just get tossed over here. And I've got then some water that I've already checked the temperature, and I'm just going to wash that area with warm water. And so I'm taking a peek, and I really like to just go around that area, Mrs. Smith, and things look great. The stoma, it's kind of a mucous membrane, and it's a beefy red color. It's kind of the color that would be inside your inner cheek. and it's moist. That's all appropriate, beautiful. It's protruding a little bit from your abdomen, and that's fine. I've got just a clean garbage bag. I'm going to set that there. Now I'm just going to dry that area, and I noticed just slight bleeding from that stoma. There's so many blood vessels on there that's not uncommon, just a little bit of bleeding. Any more than that, we would want to report. I see the skin around here. There's just a little bit of redness that will go away. That's actually going away already. That's not uncommon to have just a slight redness, but that should go away. Now, there's no redness at all. There's no skin breakdown, and I'm being very careful to monitor that. So I really want to make sure that that is dried off. Very good. All right, things look pretty good here. So I'm going to set that here. Do you have any questions, Mrs. Smith? No? Okay, so then I'm going to get some of my other supplies ready. I'm going to wash my hands. And really, because we just cleaned that off, I'm going to put on my gloves first. I'm going to cover that area so nothing comes off. So I'll cover that real quickly while I get some of my other supplies ready. But that stoma looks real good. It's beefy red. It's glistening. There's no nerve endings there, so there should be no pain. Nope, you're not having any pain. Wonderful. All right. Then I've got just a sponge here. I could use a tissue, but I'm just going to cover that up while I get some of my other supplies ready. All right, first thing I'm going to do, so I've got some clean gloves. I'm going to have to measure that stoma because I want to get as close as I can, the faceplate to fit there. I don't want it too snug, so I'm going to take a peek here, and I'm going to measure what I've got. Boy, that's way too big because there's too much skin around there. That's too tight. Wow, this one looks like it's going to work. It's 1 3/4 inch. It should be about a 1/6 of an inch to an 1/8 of an inch close to that, so hardly any skin. So about 0.3 to 0.4 centimeters, and that one looks real good. So I'm going to set that there, and I've got to remember which one I've measured. And then while I'm waiting, I'm going to put some skin prep around here and let that dry. That skin prep is very good. It's going to be just another layer to protect the skin. So I would have actually opened this up and put that on. Alrighty, good. Now I'm going to take this. I've got a new faceplate, and I'm going to open that up. I'm finding where my little opening is. How are you doing, Mrs. Smith? All right, beautiful. I'm going to put this measuring guide right on over and measure what I did on her around her stoma, and that's the 1 3/4. So I'm going to draw it, and again, I've got clean gloves on. There we go. Oops. Great. And if you didn't have a circle that fit, you'd get one near it, and then you would really want to cut, just about about an 1/8 of an inch to a 1/6 of an inch close. So I'm just cutting out the faceplate. So Mrs. Smith, you've got a two-part appliance. There are one-part appliances that are out there, but you've got a 2-part. So that one we can empty with the use of the clamp. All right. I can toss that, and I like to kind of smooth that area out in there. That skin prep should be dry. You're doing okay? All right. I'm going to peel this off on the back. It'll be sticky. And some places I've seen, they've had a paste that they would put a bead of paste around here. So that may be out there for some people, but for right now, this looks very good. And again, I need to get a very good fit here because I don't want that skin integrity underneath here. I want that very good skin integrity. All right, I'm gonna slip that right on over. And now a real important step, Mrs. Smith, I'm gonna hold it there for about 30 seconds. Let's see my watch. There. All right. Happy Valentine's Day, by the way. Today's Valentine's Day. And you know what I'm doing here? It's kind of melting that wafer, or just my body heat is helping that adhesive stick to your skin, because I might not change that for another week. I change it if it's starting to come pull apart, or again, if there's any kind of burning sensation, there could be skin breakdown, but generally I change it once to twice a week. Beautiful. All right, that looks good. So really, I've got a nice seal here for you. What I could do is I could tape around there if it starts coming up, but we look pretty good. Now I'm going to take a new bag. Remember, my old bag I'm going to take and wash and hang out and dry that one because you can reuse it. I've got a new clamp here on the end. So what I'm going to do is start down here, and it's almost like a Tupperware. It's like a little flange, and I'm going to start down here. How are you doing? Okay? I'm going to make sure I get that on very good. So that should be very good. It's on, and I want to just reiterate, when this bag gets about a half to a third full of that feces, we want to empty that out because it can get too heavy and it can pull off that faceplate, and then that's where we can get some skin breakdown occurring. And if there's ever any gas that happens to be in here, we can just burp it out, they call that. I can lift off the top here and let out some of that gas if I need to. So that's how that is taken care of. There's also some drops we can put in the bag to control some of that odor. And there's also some charcoal filters in those bags. But really, Mrs. Smith, everything looks good. Abdomen looks good. No distension here. I was checking that. That feels real nice and soft. Do you have any questions? Okay, well then tomorrow I'm going to have you try and take off that clamp on the bottom. We'll see how that goes. All right, I'm going to put this back here. And I'll take this off. I'm going to take off my gloves. I'll wash my hands again, and then I'll lower that bed. Okay, thanks so much, and I'll be back in about a half an hour. Bye-bye.